Thank you for joining today's conference call with Governor Andrew Cuomo. I'll now turn it over to Governor Cuomo.
Good afternoon, everyone. I'm joined by Dr. Zucker, Beth Garvey, Kelly Cummings, Melissa DeRosa, Robert Mejica. COVID numbers today. Positivity 4.1. 46 New Yorkers passed away from COVID yesterday. One New Yorker passing away is one too many. But 46 is the lowest number since November 27th. So that is relative good news. 4,400 hospitalized, 885 in ICU, 576 intubated. Positivity by region, number one, in reverse order. You don't want to be number one. Mid-Hudson, 4.6. Long Island, 4.4. New York City, 4.0. Western New York, 2.3. The Comeback Kid, Western New York. Capital Region, 1.9. Finger Lakes, 1.7. Mohawk Valley, 1.7. North Country, 1.4. Central New York, 0.9. Southern Tier, 0.5. Statewide, 3.2. That's the statewide 7-day average, 3.2. New York City, Queens, 4.5. Bronx, 4.3. Staten Island, 4.3. Brooklyn, 3.9. Manhattan, 2.4. We have an issue that we have been watching. One of the new words that goes in the COVID dictionary, variants of interest. And I'm going to ask Dr. Zucker to give us an update on variants of interest, Doctor.
Sure. Thank you. Thank you, Governor. So there is a Brazilian variant. It's called the P1 variant, and we identified a P1 variant in New York. It was first discovered by the scientists at Mount Sinai. It was verified by our Wadsworth Center laboratory. The patient is an individual who's in their 90s with no report of travel. And it was first detected in the U.S., obviously, at the end of January. And the CDC right now has 54 cases in 18 states. And it's a variant of concern. That's how the CDC refers to it, which means that there's evidence of an increase in potential transmissibility or more severe disease and a potential, I say potential, for reduced effectiveness of treatments or vaccines. But that's just the potential. These things are still being studied. But as we know and we've heard that the more people vaccinate, the less likely you're going to end up with variants. And so I encourage everyone to get vaccinated. We push hard about that, which we're doing in the state.
Okay. Thank you, Dr. Zucker. On vaccines, we've done 7.7 million shots in arms. 7.737,230 total doses. 7,737,230. 5,198,000 New Yorkers have received at least one dose. 2,692,000 are fully vaccinated. Over 1.65 million doses administered at the New York State mass vaccination sites and at the FEMA sites thus far. Good news, overnight AstraZeneca announced the results of the U.S. trial, and they're going to FDA for approval. That would be very helpful because that would give us yet another vaccine. The vaccines, what you're going to see is a dramatic shift in the dynamic. The problem thus far has been the supply of the vaccine, and we have been limited by supply, which we said on day one was going to happen. And the message has been the same every week from every state. We need more. We are now basically in a flat period in terms of supply. The past couple of weeks, the number has basically been flat in the allocation from the federal government. What you will see in the next couple of weeks is a dramatic increase in the allocation. Johnson & Johnson is going to ramp up with a partnership with Merck. If AstraZeneca comes online, there's going to be a ramp up. Pfizer, Moderna are ramping up. So you will see a spike in the allocation. That spike in the allocation will then flip the challenge to the distribution side. We've gone from a place of needing more vaccine. Once the allocation increases the way they say it will, and the allocation could double, then you want to make sure you have enough distribution resources, especially in a big state like ours. So we are actively recruiting additional distribution mechanisms. Today we did the Roll Up Your Sleeve campaign, where we ask all faith-based organizations to partner with a local health provider and do vaccinations in their faith-based facility. Use a church, use a mosque, use a temple in partnership with a local hospital, a local community-based provider, an FQHC, to actually be a vaccination site, especially with Johnson & Johnson, one and done. That would have a significant infrastructure across the state immediately. And I announced that in Westchester with Reverend Sharpton and with representatives of the Jewish community and the Muslim community, all religious leaders. So we're excited about the potential of that. We are also increasing the eligibility for the vaccine to 50 plus, and that will start tomorrow, so people can make an appointment. 1-833 New York State 4VAX. We don't yet have the increase in the allocation, so what people are really doing is making an appointment for when the allocation does increase. But we want to get those appointments set up so when the allocation does come, we're ready for it in terms of arms that are ready for needles, which doesn't sound great, but that's what we're looking for. We have been aggressively doing pop-ups and vaccination sites in communities of need. The numbers are still off in terms of total equity of distribution. The black community still lags in terms of percentage of vaccinations. The Hispanic community still lags. The white community is somewhat overrepresented. The Asian community is about equal or overrepresented. So we are focusing on the black and Hispanic community to make sure we're getting it to them because that is, when you look at the numbers, that's the lag in the numbers. And that's what we expected going into this, right? We talked about social equity in the vaccination process very early on. So we're continuing to work on that, and we will continue to work on that. There is a hesitancy problem, distrust problem, but I think we're chipping away at it. More and more endorsers, more and more faith-based voices, more and more churches, more and more black leaders and Hispanic leaders standing up saying, I did it, it's safe. I think it's starting to make a difference, but it is a real issue that we have to continue to work at. Just for a point of clarification, the New York City restaurants are at 50%. We announced that about a week ago. New Jersey is at about 50%. Connecticut lifted their limit of capacity in restaurants. So at 50%, we are in sync with New Jersey. Connecticut is higher, but I'm comfortable with that. And we're comfortable at the 50%. We also today opened fitness centers in New York City. New York City was the only location where the fitness centers were not open. Gyms were open, but fitness centers were not open. And there was an inconsistency. So that goes into effect today. These changes, as you know, are all, we notify the state legislature. And the state legislature could change any one of these by a simple majority vote, which has been true from day one. Other than that, let's go to questions. As you know, there's an ongoing review by the Assembly and the Attorney General's office, and I'm not going to have any comment on that until the appropriate time. But let's go to questions.
As a reminder, to ask the question, you will need to press star 1 on your telephone keypad. To withdraw your question, press the pound key. Again, if you would like to ask a question, press star, then the number 1 on your telephone keypad. Please stand by while we compile the Q&A roster. The first question comes from the line of Karina Jerry from WUTR. Your line is open. You may ask the question. Ms. Karina Jerry from WUTR, your line is open. You may ask your question.
Hi, sorry about that. I didn't unmute my mic.
Okay, that happens to me all the time. How are you?
Good, how are you?
Good.
Is eligibility too fast for the vaccines? Because you can't catch up on the amount.
Can you do that one? Just explain to me a little bit more. Is eligibility too fast because you can't catch up?
Are we expanding the number of people who are eligible to get it without having enough shots actually in the arm to get in the arm?
Well, we do not have today enough allocation to vaccinate all New Yorkers. To give you a rough ballpark, okay, we have fully vaccinated 2 million New Yorkers, let's say, right? Specifically, we fully vaccinated 2.6 million. That's out of a universe of 15 million. So obviously we have, let's say, roughly 12 million more who would be eligible. We only receive about 400,000 vaccines per week right now. And we are fully subscribed for the 400. That number is supposed to double in the coming weeks. And what we're doing is when we say today 50 plus, if you call today, you'll get an appointment for a vaccine. The appointment will be, let's say, in April. We're anticipating the increase, and we're now scheduling appointments for the increase. In other words, I don't want to wait to get the increase in the vaccine and then start to schedule people. The Biden administration, and I do this with them once a week, they have said you are going to get an increase. It will be this number. So we are scheduling appointments based on that projection, so we don't waste time. And once the allocation actually comes in the door, we have the arms scheduled, if you will, to move that amount of vaccine quickly. Let me double back on you. I left one piece out. We're working on COVID. We're working on vaccinations. We're working on reopening. And we're going to get much more aggressive about the reopening, rebuilding. I spoke today about a new season in spring and rebirth, and New York needs to have a rebirth after this COVID nightmare, and it's not going to happen on its own. We're going to have to make it happen, and I laid out in the State of the State a very aggressive reopening plan, and I want New Yorkers to have confidence in that. Between now and then, we have the budget, which is a little detail that we have to accomplish. And let me ask Rob to give you an update on the budget, please.
Okay. Thank you, Governor. As you know, on the January 19th, the governor submitted his executive budget. Last week, the legislature passed what we call their one-house budget bills, which represent their priorities, and conference committees also started on March 16th. We've done analysis of both of the spending plans for both the Senate and Assembly bills, which include double-digit spending increases and tax increases to finance restorations and additions to the governor's budget. Now, the governor's budget was crafted at a time when there was a lot of uncertainty with relation to the economic recovery for the state. We had a $15 billion deficit, as well as uncertainty for any bailout from Washington to make up for our revenue loss. Since then, we have more clarity. So as of now, in our latest talks with the legislature and staffs have been meeting throughout last week and over the weekend, and we've identified over $5 billion in resources available that could be used to restore all of the reductions in the executive budget proposal. So what that means is we have an additional $2.5 billion in revenue from the consensus revenue forecast, which is really that there's been a recovery in receipts faster than we had anticipated. We haven't quite recovered completely, but the projections added another $2.5 billion, which we previously announced, and then we have additional federal aid. Together, those provide us with over $5 billion, which is enough to restore all of the reductions that were proposed in the executive budget. So as of right now, we have the resources necessary so that there would be no cuts in the governor's budget, so you wouldn't require any significant level of tax increases to pay for the restorations. So now the conversation needs to go to, what additions to the budget we have, and then how you finance those additions. We will then, through this week, try to reach agreement with the houses on, what additional resources above the $5 billion are available, and then to finance what additional priority adds are necessary in the budget. We also have one-time resources, so those are recurring resources largely, and then we're also identifying one-time resources to fund one-time expenses that are specifically related to COVID and part of the recovery. So that's where we are as of today. And again, staffs are meeting 18 hours a day to move forward and to get to an agreement by the end of the month.
Rob, let me see, Rob, if I got, let me say it a different way and tell me if I have it right. There are three basic categories. The first category is restoring cuts that our budget put in place once we hit the downturn. And between the additional revenues that have come in and the federal revenues, we can restore all those cuts. Second category are the one-time COVID-related needs. rental assistance, small business assistance, unemployment assistance. That has been largely met by additional federal resources categorized to those specific areas. The one-time COVID-related response needs, let's call them. The third category are additional needs identified by the legislature above and beyond the COVID response measures provided for by the feds. Is that an accurate statement?
That's right. That's right, Governor. So you have enough for there's the restoration of the cuts, and we've identified resources to restore all of those. There's the one-time COVID expenses, and a large part of those are funded through the federal funds and other resources that we've identified. And then it's the third category, which you described correctly, which is unrelated to COVID, not related to any reductions, because those are already taken care of. So just new spending items.
Okay.
And that's where we're at right now.
Okay. Operator, can we take the next question, please?
The next question comes from the line of Tyler Brown from Channel 13. Your line is open.
Hello, Governor Cuomo. Thank you so much for taking our questions today. I have a couple. The first question is, obviously, the CDC last week loosened restrictions when it comes to social distancing in schools from 6 feet to 3 feet. We were wondering if the state will soon be following suit on that. And secondly, we know there's a nursing home bill that was voted on by the Assembly and the Senate. That bill is now on your desk. Will you sign that bill to loosen up some nursing home visitation restrictions? Why or why not?
Okay, both good questions. Who has the answer? Beth, do you know about the nursing home bill? Would you comment on that?
Yes, so we have already taken steps to expand visitation. CDC and CMS recently updated their guidance to further expand visitation. We are evaluating the legislature's bill in light of that revised guidance. It does provide expanded visitation even in facilities where there are COVID-positive patients, which has been, I think, a significant barrier to getting visitation going in many nursing homes. But we're trying to make sure that those two measures align before we take final action on it.
Does the Assembly Senate bill go further than what CDC and CMS has as safeguards?
We have been consulting with DOH to make sure that it does not, because we want to make sure that we are adhering to CDC and CMS guidance on this.
Yeah. Dr. Zucker, have you looked at that yet?
Yeah, we are looking at that, and I think Beth crystallized this exactly correctly. We are looking at to be sure that we follow the guidelines that the federal government has put forth, but to make sure that there's safety as well for all the visitors coming in. Yeah.
Okay. And who? Go ahead.
On the school question, yes, we are looking. We are going through the guidance that the CDC put forth. They have multiple different zones, or I shouldn't say zones, but color coding of low transmission, moderate, substantial transmission, high transmission, and those are based on the thresholds for incident cases. It also looks at the physical distance for each level of transmission, and obviously New York as a state, different schools are a lot different around the state, so we are reviewing that expeditiously. That you may have more. Yeah, sorry.
Just so we're clear, the CDC guidance going from 6 feet to 3 feet is not a universal guidance. It depends on the transmission rate of that school in that area. Is that correct?
Right. That's correct. And the physical distancing for each level of transmission is right. They put out two tables about this, looking at the incident cases and the physical distancing for each level of transmission, based on just what you were saying, the number of cases in that area, in that particular county or area. Yeah.
Okay. Thank you. Operator, next question.
Your next question comes from the line of Barbara O'Brien from the Buffalo News. Your line is open.
Thank you. Is the decision to follow whatever guidance the state health department comes out with, is that on whether to open up to 3 feet for those applicable schools, is that up to the state, or can county health departments make that decision on their own, as some of them have done?
Well, the county health departments, correct me if I'm wrong, Beth or Doctor, the county health departments make decisions subject to the state guidance. Does the state guidance now leave it to the local school district on the physical distancing?
State guidance right now would say that a local district could do less than 6 feet provided that physical barriers were in place in between students. So right now, the minimum state guidance does not comport with the guidance that the CDC has issued, so that is why we are looking to update that right now.
So right now, a local school district can do less than 6 feet with a physical barrier.
Correct.
The CDC CMS guidance of this from 6 to 3, depending on the transmission rate in that school district, is what is being considered now and has not yet been adopted by the state.
Correct, and there are certain other requirements related to cohorting students as well that require students be able to remain cohorted throughout their school day.
On the CDC reduction to 3 feet?
Correct. So we may have further modifications beyond just removal of barriers in order to achieve what CDC has put forward.
All right, so then the CDC guidance is you could go from 6 to 3 if you were a school in a low transmission rate and if you cohorted students for the entire day.
Yes.
All right, so it's not that easy. Operator, let's take one more question.
One moment. Your next question from the line of Shannon Young from Politico. Your line is open. You may ask your question.
Hi, Governor. I had 2 questions for you. One, wanted you to comment on the allegations facing Tom Reed. Do you think that it's appropriate for him to not run for re-election? And do you think that allegations should preclude candidates from seeking office? And also, just wanted to get an update on the status of the racial disparity study. Melatra said it was supposed to be out in the first quarter of 2021, and we still haven't seen it yet. And I know you've been making a big push to address disparities in the vaccine rollout. Just wanted to get an update on that as well.
On Mr. Reed, I have no comment. That's up to Mr. Reed. The racial disparity study, I do the racial disparity number on vaccines almost at least several times a week. We have posted the statewide disparity and the regional disparity. I just talked about it in the Hudson Valley. As I mentioned before, the white population in general is vaccinated at a higher rate than their relative population. Black community is at a lower rate, the lowest rate. Hispanic community is at a lower rate, but not as low as the black rate. And the Asian community in some cases is doing better, actually, than their population. The racial disparity study itself, does anybody know what that is and where that is?
Yes, Governor, that was a study that we talked about at the height of COVID that was being undertaken by the SUNY system, and Jim Malotris is working on them. And I do know that he did say we'll be back at the beginning, the first quarter of this year. And so, Shannon, I can check on that, and the press office can get back to you, and we can make sure to put it out on Twitter so all of your colleagues have the same information.
Is it different than the numbers that we go through every day?
Yes, it's the general impact, the racial, the differences on the different various races of COVID generally.
Do we have those statewide numbers and regional numbers that I do daily up on the website?
Yes, and they're updated every 24 hours.
Okay. All right, guys. Thank you very much for taking the time, and enjoy this beautiful weather. Not as much as I did. I got a little overdone by the sun, but after the long winter, it was good to feel the sun. Thank you very much. Thank you all. Have a good day. Bye.
Ladies and gentlemen, this concludes